Hello and welcome everyone. We're here with the Healing Hope team, healinghopeteam.com. I'm Cindy Mirapol and I have a special guest today, Dr. Akbar Khan. And the subject is medical ozone. So first I want to introduce Dr. Akbar Khan, MD, IMD, DHS, FAAO. He is a graduate of the University of Toronto Faculty of Medicine, 1992. He got certified in family medicine and is the co-founder of Medicor Cancer Centers, and that's www.medicorcancer.com, the first integrated private cancer clinic of its kind in Canada since 2007. And Dr. Khan has gained international recognition for his work and gentle off-label cancer therapies, such as low-dose naltrexone and dichloroacetate. In 2018, he received the title of Integrative Medical Doctor from the Board of Integrative Medicine. And in 2019, he became one of 3 physicians in Canada to earn a fellowship from the American Academy of Ozone Therapy. In 2019, he also founded the Sana Via Wellness, a wellness division of medicine. He regularly publishes in peer-reviewed journals, and for the last 22 years has been invited to present lectures on ozone therapy, integrative cancer therapy, and quality of life. So welcome, Doctor.
Thank you, Cindy. It's really a pleasure to be on your show.
Thank you. Always a pleasure to have you. And if you want to start with, first of all, you could tell us, I know some of the applications are for nerve injury, osteoarthritis, cancer, back pain, and also preventative for your immune system. So if you can go into some more detail about how ozone therapy is used medically.
Oh, yeah, for sure. Yeah. So ozone therapy is one of these things that, most doctors really haven't heard of. Or if they've heard of the therapy, then they're probably going to think that it's quackery, because I know that that's what I used to think anytime somebody suggested it to me. And that's really unfortunate, because that's kind of a bias of our training. I'm a conventional medical doctor. I'm a standard family doctor. That's my training. I went to regular medical school. But since about 2007, 2008, when I opened a private cancer clinic, I started working with natural doctors, and they introduced me to ozone therapy, among other natural therapies. And eventually I realized that this is actually a very legitimate and powerful natural therapy. So ozone, what is ozone? I mean, I think people probably heard of it. They've heard of the ozone layer in the atmosphere. So ozone is O3. It's a type of oxygen. It's formed in the upper atmosphere by the reaction of ultraviolet light from the sun with O2, which is the oxygen that we breathe. So O2 breaks up into single oxygen atoms with ultraviolet light or with high voltage. And then when it comes back together to form O2 again, some of the atoms form O3. So O3 is different than regular oxygen because it's unstable. It reacts with things. And it's very interesting, because when you put tiny, tiny amounts of O3 or ozone into the body, it has tremendous healing ability, as well as prevention, as you say. So ozone therapy is actually very well researched. It's been around for decades. It's not something new. But again, as I say, most doctors have not heard of it because it's not really part of our training. Okay, so a few of the things that ozone can help with: it can help with cancer. It can help with autoimmune disease. As you mentioned, chronic pain due to arthritis, for example. It can help with enlarged prostate, with difficult infections. It's very powerful as an assistive treatment to difficult infections. So we often can combine it with other natural medicines or with antibiotics. It's good for inflammatory conditions. And it's good for just general healing and repair in the body. So it can help fractures heal faster, for example, or any type of injuries. So that's just kind of a really basic overview of what ozone is good for.
Is it used at all for anti-aging?
Well, as now that you mention it, it actually is because of its ability to help the body heal. It actually can help your tissues recover and regenerate. So one of the examples that we use it for is for arthritis. So if you have a worn out joint, and let's say even extreme cases where there's no cartilage left, you have bone grinding on bone. Let's say you got a bad knee. Ozone can actually reverse the effects of aging by allowing your joint to regenerate fresh cartilage. And we've proven this, as well as my ozone teacher, Dr. Frank Schallenberger. He's proven this and he's published that ozone can actually regenerate cartilage in a worn out joint. So that's a perfect example of the ability of ozone to reverse aging. Um, in addition to, cosmetic, which you
Right.
can use. I
I,
had some done in my face a couple of weeks ago at a
I
conference.
look,
So look any younger?
yeah, I see that. I'm going to come in next. And my next question is its safety.
Oh yes. Yeah, yeah. So this is a big thing. If somebody wants to search ozone online, there's a lot of misinformation and propaganda out there because I think that the medical industry doesn't really want you to know about it. They want you to be scared of it. So um, you're going to read about cases, where somebody may have died from ozone therapy. Well, if it's done properly, nobody dies from ozone therapy. It is an extremely safe therapy. It's actually been well studied. The risk of complications is like, I don't know, like 1 in 100,000 or something. It's very, very safe. Certainly safer than any drug that I can think of. But you should also keep in mind that the official position of the FDA is that ozone is a toxic gas that has no medical benefit. So they don't even recognize the hundreds or even thousands of scientific papers that are out there that prove that ozone therapy is effective for a whole range of conditions, as we talked about. They just have issued this blanket statement that it's essentially useless. And if I can correct them, what they're really referring to is inhaled ozone gas. You don't want to breathe it because it can hurt your lungs. But all these other methods of ozone therapy, which we're going to mention, if you put it in the body in the correct dose and the correct concentration and in the right way, it is incredibly safe.
Okay, that's good to hear. And again, a lot of drugs that are FDA approved have side effects and lead to complications and even death. So, comparatively, it is a safe modality.
Oh, absolutely. Yeah. I don't think there's any drug that has a safety profile of ozone, even over the counter drugs. Like if you think about it, Advil or aspirin or Tylenol, even. Well, if you
Um,
eat a whole bottle of Tylenol, you're going to probably be dead in 24 hours from liver failure.
right.
If you take too many aspirins, you'll probably get a stomach ulcer and you could, bleed out from that. If you overdose on ozone, you might get some nausea or a headache, but that's really about it.
Okay, let's talk about how it's applied. I know you could do it nasally, the ears, and so forth. So, if you can give us more information about that.
Yeah, definitely. So the way that you do not apply it is that you do not breathe ozone gas directly into your lungs. Other than that, there's, I don't know, probably a dozen different ways you can apply it into the body. So one of the ways we do use it is direct injection into the tissue. So let's say let's say into your face. If you want to help smooth out some wrinkles, you can actually inject ozone under the skin. You can inject it into or around a cancerous tumor, and it can help kill the cancer cells on contact. You can inject it around the prostate gland to shrink the prostate if you have enlarged prostate. You can inject it, for example, for arthritis, as I mentioned. You can put it directly into your knee joint, into your hip joint, shoulder, even spine. You could put it in your neck or in your lower spine for chronic pains, for prolapsed disc. And then some of the more powerful ways to use it to treat the whole body is you would inject it through the blood. So we prefer not to inject ozone gas directly into a vein, although there are some doctors doing that. My preference is not to do that because what happens is you're getting then bubbles of oxygen that go through your bloodstream and they end up uh, getting stuck in your lungs and it causes some side effects. Um, it's not quite as bad as if you look at the movies where somebody injects air into somebody's IV and they kill the patient. It's not quite that bad because it's oxygen gas, it's not air. However, that's the way I don't prefer to use that, and the American Academy of Ozone Therapy prefers not to use that as well. So the way we put it in the blood instead is we can either dissolve ozone gas into a saline solution, so salt water solution, so there's no actual bubbles. The ozone is actually dissolved in the water, and then we run that through your vein. Or you may use an advanced method where you remove blood from the body and you mix the blood with ozone gas. The ozone reacts with the blood, and then the blood is put back in the body without any gas. So that's an extremely safe and very, very powerful method of treating the entire body with ozone. So those are a few ways. I mean, that's not all the ways you can do it, because it's quite a long list. But those are some really some great examples of how it can be very powerful for local treatment as well as systemic or whole body treatment.
Or very simply through the ear, right?
Through the ear, yeah, that's another way where you can actually put ozone gas in the ears, and because the skin deep down in the ear is very thin and it has a lot of blood vessels, the ozone will actually penetrate into your bloodstream that way, and it will affect like a systemic treatment, like a whole body treatment.
Okay, very good. And anything else you would like to add about any of the applications or any examples of some success stories?
Well, yeah, I think this is the best part, because that's really what got me interested in ozone, was seeing a success story myself. I saw it in one of our patients who had a small prostate cancer, and he went and had ozone therapy done. This is before we were doing it. He went and had ozone therapy done at a clinic, and it was about, I think, about maybe a half-inch size tumor. And after 6 weeks of ozone therapy, he came back, and we did an ultrasound to measure the cancer, and it completely disappeared.
Hmm.
So that's really what got me interested in it. And since then, we've used it. So I'll give you a couple examples. So that's a good example for cancer. Small tumor actually disappeared with about 6 weeks of ozone therapy. Um, I'll give you an example of, let's say, chronic back pain. Okay. So we've treated, I don't know, I mean, literally dozens of patients with chronic back pain. And what you can do is you can inject ozone gas either in between the bones in the spine, or sometimes into the muscle, the back muscles, depending on where the source of the pain is. And we've had several patients who've come in with pains that they've gone to all kinds of specialists and chiropractors and surgeons, and nobody really can solve their problem. They just give them painkillers and say, well, sorry, you got to take painkillers for life. Let's say, for example, somebody after a car accident, they've got chronic back pain or neck pain. And then we've treated them with ozone, with just either sometimes one injection or a small number, let's say 3 or 4 or 5 injections. And the pain is 80-90% reduced, or in many cases completely gone. And this is, it's not acting as a painkiller, this is actually healing the problem. So once you stop doing the injections, the pain doesn't come back. It might take a year, 2 years before there's ever any issue, or it may never come back at all. So it's actually a healing modality.
Right, you just might need a few treatments then, right?
Yeah, that's right. Yeah. So we've had one guy came after, young guy, 35-year-old guy, had appendix surgery. So he had his appendix removed, with the video camera and everything, what they call laparoscopic. So two little cuts in the abdomen about this big, and they didn't heal properly. So what happened was, it was 6 months now after surgery, and he had pain in both scars, like both of the abdominal incisions. He had so much pain that his shirt rubbing on the body would cause pain, and it was a nerve pain. So clearly, when we spoke to him, we could determine this was caused by either nerves not healing in the incisions, or some nerve injury from the surgery itself. It was like a burning, very severe burning pain, and very, very sensitive skin. It was so bad that he was actually off work on disability. Okay. And sometimes people wonder, okay, is he faking it, is this real? But no, he wanted to go to work. And so what we did was we gave him an ozone injection in each of those incisions, one single injection, and the pain completely disappeared, and he's back to work.
That's
So as
true.
soon as the pain was gone, he went right back to work. He was not faking it. I mean, incredible, right? And it's so simple that the surgeon basically said, well, you got to take painkillers, and he had no other option for him. So what, he's going to take painkillers for life now, a 35-year-old guy? I mean, that's unreasonable. And the ozone was able to heal that problem with one single injection per incision.
Oh, that's a
So
better alternative for sure. That's
yeah,
great.
certainly, and no side effects whatsoever. There was almost no pain during the injection itself. We put some freezing in first, and so he was very happy, obviously.
Very good. And as far as for cosmetic, it's a lot safer than, for instance, Botox, which is a toxin.
It is safer. I mean, Botox is pretty safe too, but ozone. The nice thing about it is, first of all, it's 100% natural. It's helping regenerate your own cells. Okay,
Right.
so it's helping to heal the body. It's not a filler, so you're not putting anything artificial in the body. You can inject ozone. Ozone's a gas, right? So you can inject it under the skin. You'll form little bubbles, under the skin, but they'll absorb. And so the ozone is going to do its job. It's going to be gone, and it's like no downtime procedure as well, because you can be back to work the next day. I mean, potentially you could have a little bruising or something, but other than that, you're not going to have downtime. You can go right back to your normal activities right after the injection. You're not going to get mistakes made, like with a filler, you can overdo it, right? So ozone is not going to cause any deformities of your face. If you inject too much, no big deal. Nothing happens, right? If you don't inject enough, okay, maybe it's not going to work as well. But you're not going to get mistakes made where, you messed up your face from, from not injecting it correctly, let's say,
Which we've
right?
all
So,
seen. Yes.
so it's incredibly safe and again, natural, and it's healing the body and repairing the body.
And it's lasting, the effects are
And it
lasting.
lasts, yes, of course. If you're, let's say, repairing the skin, then that's permanent until the aging process once again causes you to have lax skin or to have wrinkles.
Okay.
So a few injections, then it's going to last for, let's say, months or years.
That's true.
And you could even do a maintenance. You could do it once or twice a year if you like.
Okay, great. All right. Anything you would like to add before we wrap up?
Yeah, I think one big application of ozone really is with autoimmune disease, right? We're,
Hmm.
we're seeing it quite a bit. It's a very common problem. Multiple sclerosis, rheumatoid arthritis, lupus, even eczema, colitis, Crohn's, all of these things. These are all autoimmune diseases. We're seeing a lot of it now after the COVID shots have been started. There's been an explosion of autoimmune problems, and ozone is phenomenal for that. Again, natural, almost no side effects. There's really no downside to trying it. For autoimmune, we use it systemically. You want to treat the whole body, in other words. So you might be doing it intravenously, like the blood ozonation, as I mentioned, where we remove the blood, you mix it with ozone, put the blood back, or ozonated saline infusion, where you're bubbling ozone into salt water. You infuse that in the vein. Um, I mean, one of our best cases, we had a young guy came to us with something called Graves' disease. So maybe you've heard of that. It's autoimmune thyroid condition where the thyroid is being uh, basically stimulated by antibodies. So your immune system is now attacking the thyroid, causing it to overproduce thyroid hormone. So this guy had an overactive thyroid caused by autoimmune disease, and he didn't want to take the usual drugs. So we treated him with intravenous ozone, what we call 10 pass, so blood ozone treatment, where you remove 200 cc's of blood, you ozonate it, you put the blood back, and you repeat that 10 times in a visit. So he wanted to do this is like the strongest therapy that we had in our office, the highest dose of ozone that you can get with the blood ozonation. And we treated him a number of times with that. And then we added some vitamin D, which is also great for autoimmune because most people are deficient. And we added something called low dose naltrexone, which is a very low dose of a medicine that helps boost some natural chemicals in your body. And that's also immune regulating. So by combining these three things together and doing some detox, he went into full remission of his Graves' disease. And he remains in remission today. It's been, I don't know, I think 2 or 3 years. Um, so no drugs. He doesn't need any more medication. The conventional treatment for him would have been either stay on thyroid suppressing medication for life, or take a radiation treatment to destroy the thyroid.
Mhm.
Right. That's one of the treatments for Graves' disease is actually destroy your healthy thyroid, and not even factoring in the underlying cause, which is that your immune system is stimulating your thyroid. So the conventional medicine doesn't even address the overactive immunity. All it does is suppress the thyroid.
Mhm.
So great case, young guy, does not have to stay on medications for life. He's in full remission of Graves' disease.
Well, thank you so much for sharing this valuable information. And I know you're currently located in Boca Raton in Dr. Mitch's Total Health office. And what is that website?
Yeah, so if anyone's interested in ozone therapy, they'll have to come into the office for consultations. So in Florida, I am at Dr. Mitch Total Health, and the website is drmitchshow.com, drmitchshow.com. So just go on the website, and then you can call or email the office. And if you happen to be in Toronto or in Southern Ontario in Canada, then just look up sanoviawellness.com. That's my office in Toronto.
Okay, and I think from memory, the phone number at Dr. Mitch's is 561-674-5555. And you could reach me at 786-457-6832. And my dog is calling for me. So thank you for joining us. And thank everyone for viewing.
Thank you so much.
Thank you.